Hello, I'm Dr. Jeanelle de Gruchy, Director of Public Health for Tameside, and I wanted to talk a little bit about where we are with COVID in Tameside. The good news is that our COVID infection rates are starting to come down, although they are coming down quite slowly, so it's really important that we keep up all the efforts to make sure that we follow the rules and stay at home during this lockdown period. Because we know that following those rules, staying at home, will mean that fewer people will get COVID and fewer people will go into hospital and fewer people will die. And that is really important for us all to be part of that effort. We also know that the sooner we bring the cases down means that the sooner our children can return to schools and our businesses can reopen. Part of the difficulty is that the Kent variant of COVID is now more than 80% of cases in Tameside. And what that means is that the COVID is far more easily able to be transmitted from person to person. So you're more able to catch it and to pass it on. The measures that you need to take to stop yourself getting infected or to passing on to someone unknowingly that you have COVID is just to remain vigilant. Remain vigilant about washing your hands, keeping your social distance, wearing a face covering. And we really would like you to stay at home as much as possible and only go out for essential visits and essential purposes. Also, if you do develop any symptoms of coronavirus, such as a fever, a new continuous cough, or a loss or change of taste or smell, please get yourself tested and stay at home. The way you can get yourself tested is by visiting the NHS website, nhs.uk/coronavirus, or by calling 119. And you need to stay at home, self-isolate immediately if you're positive for at least 10 days, and members of your household and your contacts will also need to self-isolate for 10 days. Now that's really, really important because we need to ensure that we all keep our social distance, but those who are infective or potentially are infected need to be even more careful to not come into contact with others, and that's why they need to self-isolate. The good news around vaccination is that we have done really well in Tameside and Glossop, and the rapid rollout and uptake of the vaccine means that more than 40,000 doses have been given. And most of our residents who are over 70 years of age or have a health condition that makes them extremely vulnerable to COVID have been vaccinated, as have our frontline health and care workers. So that's really, really important. We're hoping and anticipating that by the end of April, all of the first phase priority groups for the vaccination program will have been vaccinated in Tameside. So that's everyone over 50, as well as those adults who are particularly clinically vulnerable to the disease. When it's your turn to be vaccinated, you will receive an invitation for vaccination, and I really encourage you to take that invitation up. It's really the best thing you can do to protect yourself from getting seriously ill from COVID. You can still, however, get infected from COVID and pass it on. So even if you have been vaccinated, please, you do need to stick to those rules of washing your hands, wearing a face covering, keeping your social distance. So remember that vaccination protects you from getting seriously ill from COVID if you were to catch it, but you can still catch it and pass it on. So once again, if you need any information on how to support yourself, particularly if you're self-isolating or staying at home and you're finding that difficult, so if you need food supplies, financial support, or anything for mental health and well-being, please visit www.tameside.gov.uk/coronavirus uk/self-isolation. And I just want to thank everyone for keeping up their amazing efforts. It's really, really important, everything that you're doing, following those rules and helping to keep yourself, your family and our communities safe. Thank you very much.